Hello friends, this is a sequel to my first video with Dr. Aamir in an attempt to make you aware of implants and what all implants are about. And in this video, I'm going to discuss with him factors which we as doctors consider before we decide that an implant is to be used as a replacement of your missing tooth. Also the indications and contraindications of implants, and something about immediate implants and immediate prosthesis on them. So I hope you enjoy it and gain some knowledge out of it. Once we place an implant inside a patient's mouth, and when we do the treatment planning for a patient, there are certain surgeries which we have to do sometimes prior to placement of the implant, or maybe on the day of the placement itself. So can you just talk a little about those surgeries which prepare the patient for the placement of an implant?
Sure. So to discuss about those preamble surgeries, what we use are mostly what you will need would be a bone grafting, such kind of procedures. Apart from bone grafting, there is also something which we do is for tissue augmentation, which most of the times is needed for implants. That since it is always bone that people refer to when placing an implant, yes, which is one of the very definite criteria you need to look forward, that is there adequate bone available for us to place an implant. Apart from that, what also matters or other surgeries what you might do during the day of surgery or before that is the tissue augmentation. That means that the soft tissue what is present inside the patient's mouth, is it feasible enough or is it possible for us to place that implant in that thin or thick tissue depending on the patient types. So these are the two kind of normal surgeries, or we would say the required prerequisites of placing an implant would be needed. So in terms of, first to begin with, bone grafts. Bone grafting is a procedure where we put additional bone either from inside the body, we harvest it somewhere from inside in the place near the local region where we are placing the implant, or we get an bone material from outside. We place it before the implant placement or during the implant's placement, so that in due course of time, that is 4 months or 6 months, we get adequate bone so that it can sustain the current place implant, or it gives us an adequate height and length of bone where you can put the implant. Okay. So these are the two procedures you do. And sinus lifts is one of the procedures which we take under the perspective of bone grafting, where there are these hollow cavities inside our skull, inside our faces, in our skulls. So we lift those things and we put some amount of bone so that we get adequate bone in these regions. Yeah. So that is where the places where we do sinus lifts.
Okay. And for aesthetic zones, like for example the front, now people want an implant, but there are many things, like you just talked about tissue. If the tissue is less or it's too thin, then that has to be taken into consideration before placing the anterior, so that we can give them a completely aesthetic and natural look, right?
Right.
Yes. And okay, doctor, now about this we have discussed. Now I hope we are not missing anything in it. We did talk about bone grafts, we did talk about sinus lifting and bone augmentation in form of grafts, and also the tissue surgery. So these are the things that whatever structure is around the implant also has to be taken into consideration, so that after that, if it's strong enough, then obviously the implant will stay longer, and if that tissue is weak, then your implant will shake or will break. There is one more issue that I wanted to discuss, was about grinding. Certain people grind off their teeth. Okay, they become very small. When they come to a doctor saying that I have to place an implant, now that is something that I would like you to shed light on.
So the thing is that there is some patients they do have a clenching habit where they heavily bite over their teeth, either intentionally or unintentionally. Now the basic thing here is that ideally, if you have normal teeth, since they are natural teeth, biologically by nature they are a bit flexible, so they tend to move inside the place where they have been placed. So during such habits, it's fine since you have your natural teeth. But when we are to discuss implants in such terms, what we have to focus on specifically is the type of implant material we are using. Because in such cases where you are constantly grinding your teeth, you do want something of much more strengthful material which to sustain the kind of heavy forces what you're putting. So it might happen that doctor or any of your dentists who are planning to put an implant might suggest you something which needs a very heavier or a good material implant so that it can sustain that amount of force. So it is very much imperative for us to understand such habits and how to control them or how to fight against them, so that in near future we are not having problems of implant breakages, as I guess doctor was trying to
I was trying to say that only because we have seen many patients where when you put implants in abruxo, they do come with cracked implants after 5 years or 6 years. So here in the treatment planning itself, let the doctor decide what is right for you, what implant system is right for you. The implants also have many components inside. They have some mechanical designing and engineering going on. So and the doctors know about those engineering things. They know about the different connections between the tooth and the implant, and who has designed it, what kind of engineering has been put into it. So there the doctor might suggest a very expensive system also, which you find expensive, but that is actually what is going to stay inside your mouth because you are grinding or have a bite problem. Okay doctor, now this is about the bruxers, and so we did touch about the indications and contraindications. We did not talk about. Let's go in detail about that now. The contraindications and the indications, like systemically, if I have some problem. So what are the problems where I can not get my implant done or should delay till the treatment is done? What are those problems actually? So the medical issues.
Yes, doctor. So to speak very commonly of the problems what patients have in these days is the first and foremost we spoke about in the past was diabetes, since most of the people they go through it. And diabetes is one of the places where you would want to be very sure that all the other systemic factors pertaining to your sugar levels are under control before going for an implant surgery. Apart from that, the other systemic problems which you can have is blood pressure, since it will have a significant impact on your implant placement during the surgery. Also some other factors if I am to discuss, if patient is having any cardiovascular problems or no. Does patient take any drugs which tend to affect their bleeding time, or does affect their clotting mechanism? Apart from that, is there any prosthetic valve or anything as such which is present inside patient's body, or any other systemic problems which involves their skin problems or any diseases which are occurring from their own body.
Autoimmune.
Yes, some autoimmune disorders like severe allergies, which patient might have unknowingly of some specific things, arthritis, and many more things. So frankly speaking, there is a long list of such systemic problems, but to focus just on a few because patients have it. So it is always wise to get yourself systemically checked all the time, to be well assured that all your problems, let it be anything, okay, all these what I am talking, there might be relative contraindication. That means that even being existent in a patient's body can help them to still attain implants, but it is very much important that you keep them under control. Because if you don't keep them under control, the chances of failure increases.
Yes.
So
and failure increases because your body is already weak and its healing capacity is weak, and therefore the implant will not heal that well. It is nothing to do with which system you use, but it is what you are putting the implant in, which kind of system you are putting the implant in. If our biology and our system is weak, then obviously our healing is compromised, and that healing will also compromise the healing of the implant, right? Like any other thing. And as far as such things are happening to you, every doctor will ask you to go to your physician, get a clearance from them, and then everything is sorted because you are checked completely. It's not a complete contraindication, but unless and until you are not ready physiologically, and your physiology is not ready, it's not wise to just get an implant placed. So that's the reason many doctors will ask you for blood reports, blood tests, physician consents. So that is why, to just make it sure that everything is safe for you and it will work for you. Now these are and indications we know. It's like if you lose your tooth.
Yes. So indications would be that if you're missing a tooth, that means it can be a single tooth or multiple teeth. If you have completely atrophied ridges, that means you have lost all your teeth and a lot of bone has been lost. You can go in such cases. If you're missing a part of your jaw, let it be an upper jaw or a lower jaw, any part of your bone which is missing because of the surgery or because of anything pertaining to your systemic problems. So all these things focus towards a very fixed and a permanent amount of treatment if possible in
with implants, with implants and the reconstructive surgery along with the implants.
Yep.
Now, okay, so doctor, there are very, no, everybody wants the tooth very fast. Okay, so they'll come to you, they'll think that okay, they're going to place the implant today, we are going to have the tooth tomorrow. So we know that there are certain cases where immediate placement can happen or immediately a tooth can be given. But I would like you also to talk about this, like when the immediate thing is given to you, should it be permanent or should it be temporary? One, and when is that indicated actually? That okay, today you have lost your tooth and you can get a tooth just with the surgery, that kind of thing.
So yes, there have been some treatment options that you can definitely achieve even permanent as well as temporary teeth which can be delivered to the patient these days with the advent of new implants which are there in the system. Also with the conventional implants, the screw implants what you have, we definitely go for immediate placement of prosthesis, but it strongly depends on the kind of treatment bone which is available when you are placing the implant. There are some preset criteria which you have in terms of using your normal implant as well as having those long form implants, that even if you are having a normal implant, if you achieve those specific criteria, you feel that yes, we can give if you have a good amount of bone available and everything is fantastic
and a strong bone,
and a strong
tissue.
tissue is available, then in such cases you can definitely go for an immediate implant. But these are extremely subjective attributes to placing an implant or placing an immediate prosthesis over an implant. You cannot expect to have ideal situations every time.
Yeah. So, because what we get is now CT scans, and when we do a surgery, we can just take a call that time itself. Because maybe when we do a surgery, we will not go with the planning.
Exactly.
Okay, that depends like how strongly the implant has gone in, how strongly the bone is holding on to it. Or because see, this is anyway, we do get a 3D scan and everything, but the moment a surgeon works on you, that is the time the surgeon exactly knows how it is, the day he puts it. And one should be patient with these things and one should trust your doctor with these things. When he takes a decision, he's taking it for you, wherever it is, in whichever dental operatory.